Dr. Richard Collins, aka the Cooking Cardiologist. Welcome to MD Info website. I'm a cardiologist as well as a chef. This is an often question that is asked, and I try to avoid the answer as far as good foods, bad foods. There really isn't anything out there that says don't eat this, this will kill you, this will prevent a heart attack. We do know that diets in the long run and the entire recipe in meals create a heart healthier environment. So I don't like to give foods sort of this healthy halo. I like to look at the diet overall, the Mediterranean diet, rich in colorful foods, lower in animal products, and also rich in olive oil. But not one particular food works. So look at the entire diet, and remember, quantity is very, very important. How does coffee caffeine affect heart patients, and should it be avoided? Interesting question. I'm often asked this question. And many a doctor has done a study on caffeine holding a cup of Java while he's looking at the research. It is a double-edged sword. What happens in caffeine, it is a stimulant. And there are little receptors in the brain called adenosine receptors, and caffeine blocks that. So once these receptors are totally blocked, you can drink more and more caffeine and it really won't bother you. There have been mixed studies on caffeine, raising blood pressure, reducing the risk of diabetes. One clear study, though, has shown that tea is far better than caffeinated coffee. So if you really need to drink coffee, do it in moderation. That's my recommendation. What should I eat to control high blood pressure, as my blood pressure is 138/90? You know, it's very interesting. There's been a number of studies on the effect of diet and blood pressure. The number one study is the DASH diet, dietary approach to stop high blood pressure. As a matter of fact, you can get information on the internet through the National Institutes of Health. The DASH diet is very rich in potassium, low in fat, very rich in magnesium and calcium. All of those minerals are beneficial for blood pressure. You can start a diet, follow those recommendations of the DASH diet, and your blood pressure can come down just as good as first-line medications. It's first best, though, to consult with your physician before starting a diet and really make sure that that would be his or her recommendations. If my family has a history of heart attack, will I have to worry? It's very interesting when you look at family history. A number of relatives will have had a heart attack in their 70s or 80s. That's really not what we're interested in. We're interested in premature heart disease, especially someone under the age of 55. And more importantly, it's very important to know the health of your siblings, because that's your genotypes that your parents have given you. So the key here is that if you have a sibling who's had a heart attack under age 55, that puts you at almost a greater risk as if you were a smoker. So the bottom line here is keep those siblings, your brothers and sisters, healthy, and look at that premature heart disease, because that pinpoints your higher risk of heart disease in the future. Is it true eating fish can reduce my risk for heart failure? This question is all over the internet, by the way, as far as the benefits of omega-3 fats. Even Dr. Dean Ornish on one of his websites has said that fish oil will kill you if you have heart failure and heart disease. The studies are quite mixed, but we do know this, that in healthy people, the consumption of fish oil, especially supplements, helps to reduce the risk of sudden death. That study was noted in Eskimos years ago. We also know that it has benefits on platelets, keeping your platelets less sticky. In the face of heart disease, without congestive heart failure, it's been shown to be somewhat beneficial on the lipids, especially raising HDL. So I think it's very important, if you do have heart disease, consult with your physician, because taking additional supplements can be risky.